Welcome to this module on sex worker health. Thank you so much for taking the time to participate in this continuing education program. This program was put together as a collaboration between the St. James Infirmary, Call Off Your Old Tired Ethics Rhode Island, the Warren Alpert Medical School at Brown University, and the Rhode Island STD Clinic at Miriam Hospital. This module will discuss sex work and how medical providers can provide the best care possible for their patients who work in the sex trade. Sex workers are a group of patients that are incredibly varied in their backgrounds, their experiences, and their needs. However, sex workers in the U.S. have a difficult time accessing health care and caring for their health needs in the same way that other communities do, due to their status as a criminalized and highly stigmatized community. This module will look to expand healthcare providers' understanding of what sex work is and how to provide effective, comprehensive, and compassionate care for sex workers. So before we get started, I'm going to break down a few more of the specific goals for this training. And these goals include understanding what sex work is and what it is not, evaluating how our own personal beliefs as healthcare providers and values around sex work and the sex trades can impact sex workers' health, to demonstrate how stigma and criminalization impact the health and safety of sex workers, and to define the role of a healthcare provider in promoting the health and safety of their patients who work in the sex trade. Jumping into this first goal, before we work on a collective working definition, take a moment to think to yourself or jot down some notes on what is sex work. When you hear sex work, what does that mean? And following up on that, who is a sex worker? Just take a little time to think on these questions. And why are these goals that we just outlined and the knowledge that'll come in this training, why is this important for people working in healthcare to know? And finally, what do you think about when you think about sex work? Again, kind of the first things to jump to mind. So now that we've had a little time to think about where we're at coming into the training, the definition that we'll be using for sex work is that sex work is an umbrella term that describes trading economic markers of value for sexual or erotic labor through performance or physical engagement. And a sex worker is a person who performs the sexual or erotic labor. So sex work is not one specific act, it's not one specific market, it's a huge umbrella term. Some forms of sex work are legal in the US, such as pornography, stripping, professional BDSM, phone sex, and camming, but there are other areas of sex work that remain criminalized in large parts of the world, including the US, including escorting, which is exchanging of money for sex, dates, or time spent together, working in a brothel, full-service sex work, or massage and body rub that includes sexual services, or working as a street-based worker. So now that we have a working definition of what sex work is, I'd like to take a moment to consider why patients that you'll be seeing in the future do sex work. It is important as providers to consider the position that our patients are in and not make assumptions about how they got into the work that they do and why they do this work. Because again, we don't know all of the specifics of their lives. We don't know what brought them to this exact moment when we see them during a clinical interaction, but it is very helpful and goes a long way in being able to provide comprehensive and compassionate care to consider why someone is doing the work that they do and how best to support them in the position that they are in. For many people, sex work is a job like any other. Their job happens to be sex work, but at the end of the day, it is their work. And oftentimes there is lack of economic opportunity in other areas for patients that you'll be seeing. And lack of flexibility, discrimination in other areas, lack of ability to access other jobs due to immigration status, due to disability, due to discrimination, and also lack of flexibility in other occupations. And many sex workers may describe to you that they are content in their work because it allows for flexibility, it allows for pay that allows them to support themselves, and kind of a multitude of other reasons. And of people surveyed, a few quotes describing why people are engaged in sex work include being disabled. It provided enough money to cover bills that my disability checks could not. And I could not keep a job due to my chronic illness, and sex work allowed me to survive until I had access for treatments to thrive. And finally, sex work allowed me to focus on school instead of working a full-time job. The education I've gotten as a result has opened doors my parents could only dream about. So before moving forward in caring for sex workers and thinking about the best care that you could provide, it is critical to take a step back and look at your own assumptions about why people are engaged in sex work and consider how it is a job that provides opportunity, a job that provides stability, and may come with challenges, but for many of your patients is what they have chosen and provides a level of stability that they would not have access to otherwise, and is not our role as providers to judge them for that or make assumptions about their work or about their own opinions and their own stance on their work. So Rhode Island is a unique state to be taking this training in and to be learning about sex work in, because indoor sex work was decriminalized in Rhode Island for a number of years. So from 1980 to 2008, any kind of sex work was legal indoors, including full-service sex work, escorting, and was not a punishable crime. Outdoor sex work remained criminalized, but in 2008, this legal loophole was closed and indoor sex work became criminalized again. But for a number of years, sex work was decriminalized in Rhode Island, and it was a very unique state in that people were able to take care of their health and safety while working in the sex trade in a way that they weren't able to under criminalization. And this law came about because of the work of sex workers' rights advocates, of sex workers themselves who organized among their community and advocated for the best possible conditions for themselves and for their colleagues. Sex workers worldwide remain very active and remain well organized, that when thinking about the needs and the priorities of sex workers, it's not necessary to make assumptions about what this population as a community needs, because they're very well organized and very vocal about what they themselves know they need from doing sex work, from experiencing the discrimination and stigma that comes along with this. This photo is from an event that took place in 2012 called the Sex Workers Freedom Festival, that was organized alongside the International AIDS Conference, which took place in the United States and meant that sex workers internationally could not attend because sex workers cannot enter the United States from other countries. And so a similar conference was hosted in Calcutta at the same time to put together an agenda of what sex workers needed from HIV services specifically, but also more generally. And the distinct agenda items that would improve the health and safety of sex workers as identified by sex workers is an end of discriminatory practices against sex workers that lead to social exclusion, the end of criminalization of sex work that leads to incarceration and social exclusion, an end to violence against sex work and support for sex workers that have experienced violence, and access to quality housing, education, and healthcare for sex workers. And sex workers remain active globally within the United States, within Rhode Island. We'll be including some links for you to learn more at the end. But if you are looking to educate yourself more about sex worker organizing and what it is that sex workers need from various professionals, from lawmakers, I suggest that you go kind of straight to the source and look to see what sex workers are publishing, what they're kind of requesting in terms of support. As healthcare providers, we don't need to be making those agenda points for them because they've already been very clearly articulated. And so before we jump more into the specifics of the role of healthcare providers, I do want to touch on the topic of sex trafficking as well, because when discussing sex work, sex trafficking always comes up. And to get a working definition of sex trafficking, sex trafficking is involvement in the sex trade due to force, fraud, or coercion, or the involvement of a minor in the sex trade in any capacity. So as far as minors go, if someone under the age of 18 is involved in the sex trade, that is considered trafficking. It may look very different from trafficking in adults, but kind of any involvement of a minor is considered trafficking. And when it comes to trafficking, the terms force, fraud, and coercion are quite vague, and it is very different from person to person, because there is also the area of coercion that includes economic coercion and someone not having options outside of sex work, as we discussed earlier, but this may not necessarily mean that someone considers themselves to be trafficked. So I do suggest that you stay away from imposing labels onto someone and instead listen to your patients and listen to what they're describing to you and what their needs are, because someone who is working in the sex trade but would prefer to exit and hasn't been able to may fall under this definition but may not consider themselves a victim of trafficking. They may simply want to exit and are trying to figure out how to, and the ways to support them don't necessarily look like involving the law and may look like more of providing support to get their needs met in terms of housing, in terms of employment, in terms of finding stability. And so there is definitely this overlap between sex work and sex trafficking, that not all people who do sex work have been trafficked or consider themselves trafficked, and not all people who have survived sex trafficking consider themselves to ever have been sex workers or do sex work. But there is an overlap that does clearly need to be acknowledged, but it is important that these two things should not be conflated all the time. That just because someone does sex work does not mean that they have been trafficked, and just because someone has been trafficked, it does not mean that they have always been involved in sex work and will always be involved in sex work. And we'll touch upon this a little bit more later, but it is also very important to keep in mind this distinction when you think about the care that you're offering someone, and that trying to extract them from the situation that they're in and involve law enforcement as assisting someone in trafficking kind of manuals will suggest is often not what patients want and not what patients need from their healthcare providers. For a little bit more clarity on what sex work laws are in the United States, in Rhode Island, escorting and full-service sex work indoors and outdoors, as we described, are illegal. They are classified as a misdemeanor in Rhode Island, and you can face fines and prison time, which both increase with the number of charges. There are similar laws in most states, except for Nevada does have a few counties where sex work is legalized but not decriminalized. And federally, moving across state lines and performing full-service sex work is a federal crime, and there are different crimes kind of on a federal level when you are have charges in multiple states. The next big topic that I want to get into before we talk about clinical specifics is the barriers to health for sex workers. And we'll be talking about two fundamental barriers to health for sex workers, which are stigma and criminalization, and how these two barriers trickle down into so many areas of a sex worker's life and kind of provide a barrier to accessing health care, to getting good health care, to healthy practices, to obtaining the resources that someone needs in order to stay healthy, and how to consider what lies at the foundation of what stands in the way of many sex workers having the health outcomes that they would like. And so stigma is shame and disgrace that society places on people for an attribute that society deems unacceptable. And stigma is also accompanied by discrimination, which are the actions and behaviors that reflect this designation of shame. And so stigma can take a lot of forms, and then the discrimination that puts this stigma into action can also take many forms in almost any area of someone's life. And criminalization, again, is legal persecution for being involved in sex work. And as we've discussed, sex work is a punishable offense in the majority of the United States, and legal persecution does put sex workers at risk for incarceration and forces many sex workers to remain isolated. And as Gwyn Kirk and Margot Okazawa Ray write in Women's Lives, Multicultural Perspectives, criminalization is a political process whereby people who do not fit a dominant societal norms are labeled criminals, and their circumstances and behavior are labeled as crime. And additionally, there have been many global systematic reviews studying criminalization of sex work and health outcomes, and they'll be linked at the end of the presentation. And they've found a connection between worse outcomes in criminalized settings, and that decriminalized contexts have improved sex workers' relationship with law enforcement and access to justice, negotiating powers with clients, and ability to obtain the resources that they need throughout their lives. And so these two barriers, they run very deep and can kind of trickle down into most any other area of a sex worker's life. Also included on here, occupational hazards. And this is what is most frequently talked about in terms of sex work and health, and has to do with the fact that sex work, of course, is sexual in nature. And so occupational hazards may include condom breakage, risk for transmission of STIs, or anything that has to do with the work that sex workers are doing itself, but we would like to keep occupational hazards as its own distinct category and acknowledge that a lot of the health difficulties that sex workers struggle with don't have to do with these occupational hazards, and more so have to do with the barriers that they face due to criminalization and stigma. Because as this next slide shows, the barriers that criminalization and stigma place upon sex workers as a community exist at almost any level. They exist at an intrapersonal level, kind of within someone's person and how they relate to their own self-worth and need for safety. Interpersonal, kind of bringing that into someone's relationship and how stigma and criminalization would impact your interpersonal relationships that are so necessary for someone to stay healthy and thrive and feel good about themselves. They exist at a community level. If someone is stigmatized and criminalized, they will have difficulty accessing the kind of community support that we know is very important to take care of one's health. Exists at an organizational level and also at a public policy level. And so stigma and criminalization, they do run very deep and impact sex workers' lives in a multitude of ways that are often difficult to parse out from one another because so many areas of someone's life are affected by stigma and criminalization. And it is important to consider how criminalization and stigma shape the ways in which sex workers are able to care for their own health and access high-quality health care, because both of these factors make sex workers isolate them from support, from family, from friends, from healthcare, from other areas where someone who is not so stigmatized and criminalized would be able to gain support and gain stability. And this often does put people at risk for violence. Sex workers experience disproportionately high rates of violence due to this very vulnerable position that they're placed in. May experience substance use, experience trauma while in their regular lives or while working, and mental health struggles. And again, all of these things are not inherent to sex work, but many sex workers may arrive at their work already facing these challenges, and these challenges may be exacerbated by the fact that sex workers find themselves so stigmatized and find themselves so criminalized. And in wrapping up discussing some of the barriers that sex workers face and a lot of the violence that sex workers face due to criminalization and stigma, I'd like to include a quote from Sex Workers Outreach Project Behind Bars that also describes that a lot of the challenges that sex workers face are not isolated because of sex work, that it is necessary that we consider the other areas of a patient's life. These challenges are not just because of the fact that they're sex workers, are often compounded by their race, by their gender, sexuality, or immigration status. So Sex Workers Outreach Project Behind Bars writes that the majority of violence against sex workers is not just violence against sex workers. It's also violence against trans women, against women of color, against drug users, against immigrants. We cannot end the marginalization and victimization of all sex workers without also fighting transphobia, racism, stigma, and criminalization of drug use and xenophobia. So moving into the next part of this module, I'd like to talk a little bit about the experiences of sex workers within healthcare and how sex workers that have been surveyed in the past few years currently experience their healthcare. So when sex workers are seeing their healthcare providers, the majority of sex workers do not disclose that they do sex work. Of 1,500 sex workers surveyed in 2017, 42% did disclose and 58% did not disclose. And when asked if they thought disclosing their sex worker status would improve their healthcare, 45% said yes, 25% said no, and 30% said depending on the provider. And of the 30% that said depends on the provider, most of them described that they would like to be able to disclose that they do sex work to their provider to have a more open conversation and so that their provider was completely informed, but that they would only like to disclose if they knew their provider wouldn't judge them, wouldn't report them, and that they wouldn't receive worse health care because of the fact that they disclosed. We'll talk more in the next module about building trust, but in order for sex workers to disclose their status as a sex worker to a healthcare provider, a certain level of trust has to exist, and knowing that they will not be judged or they will not be treated hostilely is important in considering how to get to the next level that sex workers reported they would like to be at, where they're able to disclose to healthcare providers. And something that I would also like to touch upon is the narrative that sex workers are vectors for disease, which is not anything new. This is a poster from the 1940s that talks about smashing the prostitution racket, that prostitution spreads venereal disease. And this is very much a conception that's live and well, that all sex workers do is spread STIs, that sex workers are uneducated, and that even being around a sex worker will contaminate you with an STI. And it's important to look at the historical roots of this narrative and consider that it is not necessarily based off of the facts that exist in this day and age, but off of this historical notion that sex workers are vectors for disease. Because again, in this study that was conducted nationwide in 2017, if we're looking at condom use among sex workers and among the general public, the 1,500 sex workers reported that were surveyed report that while they're working, 9% never use condoms, 13% rarely or sometimes use condoms, and 78% most often or always use condoms. And while not working, 20% never use condoms, 37% rarely use condoms, and 42% most often or always use condoms. And when comparing that to the general American public, for cisgender men, 47% never use condoms, 34% sometimes use condoms, 19% always use condoms, and for cisgender women, 60% never use condoms, 25% sometimes use condoms, and 15% always use condoms. So as far as condom use goes, condom use rates are much higher among population that is sex worker than the general American population, and this is to say that we can make assumptions about the safe sex practices of sex workers and that sex workers remain a vector of disease, but that's simply not where things stand. So sex workers are often much more aware of how to remain safe when having sex and how to keep their partners safe as well. Before we move into the next module where we talk about specific practices, I'd like to take a minute to consider how to create environments within healthcare to provide comprehensive and high quality care for sex workers, where sex workers will not have experiences where they run up against people who assume that they're carrying diseases simply because they're a sex worker. And this starts with promoting ongoing provider-patient relationships that are trusting, that are long-term, and where patients can go and know that they can talk about their lives freely and won't be judged, and that they will receive the support that they're looking for, the healthcare that they're looking for. Environments that promote peer engagement are huge. This may look like hiring peer navigators, connecting and hiring sex workers within healthcare to provide support to patients. Promoting a harm reduction framework and harm reduction practices within healthcare is huge, and carefully considering the role of healthcare providers. And now, having discussed the unique challenges that sex workers face in caring for their health, what role do healthcare providers play in caring for the health and well-being of a sex worker? And can kind of take a moment to think about that on your own before we jump into more of a conversation. And additionally, what should our main goal be in individual clinical interactions and more broadly as healthcare providers? The role of a healthcare provider is to provide healthcare to patients, and these patients may be sex workers, they may not be sex workers, but the role of a provider is not to judge or to destabilize the source of income of the patient if they come in and describe that they do sex work. The role of a healthcare provider is to look after a patient's health needs, to, if they are able to meet someone's needs, to provide them with services, with care, with a treatment plan or medications. And the role of a provider is not to make assumptions about their patients and what a patient needs and what a patient should be doing or should be thinking. And for many patients, sex work allows them to remain financially secure and stable. And for others, it is a source of stress or violence. Give a patient an opportunity to tell you about their work and then support them where they're at. There's no way to tell what someone's relationship to their work is if they're doing sex work if you don't take a chance to step back and listen, because patients will come in with immensely different perspectives and immensely different experiences regarding sex work. For some of them, it's the best job that they've ever had and they have no interest in ever exiting. And for some of them, they are very displeased with their work. They've faced violence and they are ready to exit. But making assumptions about what they need and how to get them there will not improve their health outcomes, will not build a long-lasting relationship. Harm reduction approach of meeting patients where they're at and rolling with resistance and then working together to establish goals is huge and is key to providing the best care possible for sex workers. So that closes out this first module. Some additional sources, if you're looking to learn more, include the St. James Infirmary has an online site. Call Off Your Old Tired Ethics Rhode Island has an online site. The Global Network of Sex Worker Projects has a really large online database of research. The Red Umbrella Fund and Swap Behind Bars. And so now if you are taking the second module, you can continue on to the best practices module. Thank you so much for taking the time to participate in this continuing education program. I hope that it was informative and helpful, and next we'll be talking about some best practices in caring for sex workers.